So primarily I do labiaplasty. There's a group of female plastic surgeons that get together routinely and discuss this, but so I'm copying this phrase from one of my friends, but she's an unapologetic trimmer, meaning that she does a curvilinear trim technique. So that means that you're gently curving the incision along the edge of the labia. It does a couple of things. You can get very good symmetry that way. You can easily match the length left behind so that you can have it um, be behind the labia majora. So it's easy to mark it that way. It heals really well. The scar is imperceptible when it heals. It removes a lot of times the edge of the labia is hyperpigmented, and women tend to want to have that removed. So by hyperpigmented, I just mean darker in color than the rest of the labia. And so you remove that when you're doing the curve a linear trim. Um, the other major way of doing labiaplasty is a wedge technique, and so that is taking out, like, kind of like a pizza slice piece out of the labia and then, sewing it together. One of the pros of that is that the incision is on the inside, it's internal, but it doesn't remove hyperpigmented areas. It is really prone to healing problems just because I won't go into the blood supply to the labia minora, but it doesn't really lend itself to this technique. You have to be pretty careful. Also, you cannot, you can't get quite the amount of resection that you can do sometimes with a trim. Resection is the amount of tissue that you're going to remove. So you're a little limited with a wedge technique in that you can take out a pretty large wedge, but if you do, you can create tension in places that you don't really want it, which can again either heal to unfavorable scarring or wound healing problems, neither of which you have with the trim technique.